Okay, hello everybody. We're going to talk quickly about lung cancer. My goal is to give you a brief overview of lung cancer and what are the different subtypes so that when you go back to studying your class material or textbooks, you're not so lost and your time is more efficient. So let's talk about lung cancer. Basically, lung cancer is going to show up as some sort of a granuloma. Granuloma is pretty much like a circular thing that you're going to see in the lung. There are basically two types of granuloma. One of them is benign and the other one is cancerous. The one that's benign is usually due to TB, fungus, or you could have a hamartoma, which is basically a neoplasm of blood vessels and cartilage growing together. So that's hamartoma is basically, it's very benign. It's just cartilage and other mesenchymal tissue that is just growing together. Now we're going to go to the cancerous form. So the cancerous form, you can divide it into a small cell carcinoma, which I have highlighted as SSC. This is a small cell carcinoma. Or you can have non-small size cell carcinoma, which is everything in pink. So SSC, small cell carcinoma, is the worst one. It's poor. The prognosis is very poor. It's fast growing. Basically, you see three types of things. You see increased ADH, you see an antibody, and you see ACTH. So increased ADH is going to cause hyponatremia, which is less sodium compared to water. Remember, ADH is going to pull sodium in and it's going to pull water in, but water is going to be a whole lot more than sodium. This is why you're going to get less sodium in the body, and it's going to show up as some sort of a CNS, central nervous system symptoms like confusion and so forth. It's going to have antibodies to the calcium channels, and that's going to give you the Lambert-Eaton syndrome, which is basically like muscle weakness and so forth. Again, this is a brief overview. Lots of ATH is going to give you Cushing's syndrome, high blood pressure. So this small cell carcinoma is a paraneoplastic syndrome, and I've driven a picture of it. You can see the cells. They have a hyperchromatic nucleus. There are lots of cells. It's very undifferentiated, as you can see right here. And another thing is that I've driven a cigarette here, so it's a cigarette smoke, and Cushing cells are found in SSC. Now let's talk about the non-small cell carcinoma, non-small size cell carcinoma. So you have large cell carcinoma, you have adenocarcinoma, squamous cell carcinoma, and carcinoid. Let's talk about adenocarcinoma. This one is going to be in the periphery of the lung. Usually it's a female, non-smoker. There is no invasion of the alveoli. And you see the cells as these tall columnar cells, which I've drawn in gray for you here. A subform of adenocarcinoma, remember, adenocarcinoma is the #1 carcinoma for lung cancer, and it's usually non-smoker females. Another subtype of adenocarcinoma is bronchoalveolar carcinoma, and it looks a little bit like pneumonia on X-ray. So that's why I have written pneumonia here. Now let's go to the squamous cell carcinoma. This is going to be central, and it's going to be hilar. The hilar, you're going to see a mass in the hilar part of the lung, and you're going to see the intracellular desmosomes. You're also going to see a lot of PTHRP, which is the PTH hormone, but it's like the mutant version of it, and it's going to cause your brain to release calcium. That's why you're going to see increased calcium. And these are squamous cells, and they have these nodules, these circular nodules. Let's talk about carcinoid. So that's going to be a little bit rare. It's usually a GI tumor that gives you the signs of serotonin, which lead to bronchoconstriction. So you get asthma and you get diarrhea because everything is moving much faster through your GI. So it's the neuroendocrine type of lung carcinoma. And then you have large cell carcinoma. It's the prognosis is poor. It's throughout the lung, and you can see large cell. Now, you also have something called a Pancoast Carcinoma. Pancoast is the name of the radiologist that discovered it. That's why it's called Pancoast Carcinoma. And it's a mass in the upper lobule. So think about what is on the, if you have a mass in the top of your lung, it's going to release PTH. Also, it can do a bunch of things. It can compress your sympathetic ganglion chain, so you get Horner syndrome. You're also going to see the signs of like edema in your arm and neck. Pretty much all, and also the last thing to talk about is metastasis. So you can have metastasis from the lung, which is a little bit more rare. It can go to the adrenal glands, your brain. It can go to bone and liver. When you have cancers coming to the lung from other parts of the body, like breast and colon, which are the number one places where the cancers to the lung come from, you can tell that it is a secondary metastasis, because you're going to see more than one. Like if it's a primary tumor of the lung, you're going to likely see it in one spot. But if it's a secondary tumor that originally started somewhere else and now it's going to your lung, it's going to have different spots in the lung where you're going to see metastasis. So let's talk about generally about what happens in all these lung tumors. So all of them, they can grow, so you can get like airway obstruction, so you can get breathing problems. You can also compress nerves like phrenic nerves, so you get difficulty breathing, the diaphragm is paralyzed, or they can compress the recurrent laryngeal nerve, which can make it harder, like we can show up as like changes in the voices. You can also compress the superior vena cava. Remember, the superior vena cava drains the head, so you're going to get a patient that has like facial edema in the morning, headaches. They can also be in some sort of coma. You can have a patient with a neoplastic syndrome like Cushing's and ADH, hyponatremia, and so forth. Now, all of this shows up in the x-ray as a coin lesion. So it's a little bit of a coin. The tissue is non-calcified, so that's why it shows up as a coin lesion. So hopefully this gives you a really quick 6-minute, and if you watch this video in 2 times, then maybe like a 3-minute overview of what's happening in lung cancer. All the best to you. Please leave a comment if this was helpful, and I hope to see you in the next video.